Mackenzie Shirilla, a case of a wrongful conviction. Part 3. In this section we will discuss the following. Sudden medical emergency explained. Sudden medical emergency. Mackenzie was diagnosed in November 2017 with a condition called postural orthostatic tachycardia syndrome, POTS. Detectives investigating this case became aware of this diagnosis when they received medical records on August 8 and again on August 12. According to detectives' notes, Mackenzie's diagnosis was not looked into. If the detectives investigating this case had performed their due diligence, they would have learned more about this condition and how it would have been a contributing cause to this automobile crash. However, failure to investigate such matters appears to be what can only be described as intentional ignorance. While not an official name, it can be best described as intentionally ignoring information because it may prove to be problematic to an established narrative or premise. According to the Cleveland Clinic, postural orthostatic tachycardia syndrome is a condition that causes the patient's heart to beat faster than normal, especially when they transition from sitting or lying down to an upright position. It's a type of orthostatic intolerance. Also, the National Library of Medicine states that those who have POTS experience arrhythmias, at a frequency similar to what is seen in patients undergoing primary evaluation for cardiac symptoms such as chest pain, palpitations, and syncope. Why should we care if Mackenzie had POTS which caused her to experience an arrhythmia while driving the car? The reason why is as follows. Had the detectives performed their due diligence regarding the POTS diagnosis, they most likely would have referred to documentation available on the Cleveland Clinic website.
What is postural orthostatic tachycardia syndrome, POTS? Postural orthostatic tachycardia syndrome, POTS, is a condition that causes your heart to beat faster than normal when you transition from sitting or lying down to standing up. It's a type of orthostatic intolerance. Each word of postural orthostatic tachycardia syndrome has a meaning. Postural, related to the position of your body. Orthostatic, related to standing upright. Tachycardia, a heart rate over 100 beats per minute. Syndrome, a group of symptoms that happen together. Normally, your body's autonomic nervous system balances your heart rate and blood pressure to keep your blood flowing at a healthy pace, no matter what position your body is in. If you have POTS, your body can't coordinate the balancing act of blood vessel constriction, squeezing, and heart rate response. This means that your body can't keep your blood pressure steady and stable. This causes a variety of symptoms. Each case of POTS is different. People with POTS may see symptoms come and go over a period of years. In most cases, with adjustments in diet, medications, and physical activity, a person with POTS will experience an improvement in their quality of life. Who does POTS affect? The majority of people with POTS are women and people assigned female at birth aged 15 to 50 years. But men and people assigned male at birth can also have POTS. You're at a higher risk of developing POTS after experiencing the following stressors: significant illnesses, such as viral illnesses like mononucleosis or serious infections. Pregnancy. Physical trauma, such as a head injury. Surgery. People who have certain autoimmune conditions, such as Sjogren's syndrome, lupus, and celiac disease, are also more likely to develop POTS. How common is POTS? POTS is common. It affects about 1 to 3 million people in the United States. How does postural orthostatic tachycardia syndrome, POTS, affect my body? Normally, when you stand up, gravity causes about 10% to 15% of your blood to settle in your abdomen, legs and arms. This means that less blood reaches your brain, which can cause brief lightheadedness. If you don't have POTS, this lightheaded feeling doesn't happen often because your leg muscles help pump blood back up to your heart. In addition, your autonomic nervous system turns on a series of rapid responses. To compensate for the lower amount of blood returning to your heart after standing up, your body releases the hormones epinephrine, adrenaline, and norepinephrine. These hormones typically cause your heart to beat a little faster and with more force. Norepinephrine also causes your blood vessels to tighten or constrict. This all results in more blood returning to your heart and brain. People with POTS tend to pool a larger amount of blood in vessels below their heart when they stand. Their body responds by releasing more norepinephrine or epinephrine to try to cause more squeezing of their blood vessels. For several reasons, their blood vessels don't respond normally to these hormones. Because their heart remains able to respond to the norepinephrine and epinephrine, their heart rate often increases. This imbalance causes many possible symptoms, such as dizziness, fainting, and exhaustion. Symptoms and causes. What are the symptoms of POTS? You can develop POTS suddenly or it can develop gradually. Symptoms happen immediately or a few minutes after sitting up or standing. Lying down may relieve some of the symptoms. POTS has several possible symptoms, and they vary from person to person. Symptoms include dizziness or lightheadedness, especially when standing up, during prolonged standing in one position or on long walks. Fainting or near fainting. Forgetfulness and trouble focusing, brain fog. Heart palpitations or racing heart rate. Exhaustion, fatigue. Feeling nervous or anxious. Shakiness and excessive sweating. Shortness of breath, dyspnea. Chest pain. Headaches. Feeling sick. Bloating. A pale face and purple discoloration of your hands and feet if they're lower than the level of your heart. Disrupted sleep from chest pain, racing heart rate and excessive sweating during sleep. POTS symptoms often get worse in the following situations. Being in warm environments, such as in a hot bath or shower or on a hot day. Standing frequently, such as when you're waiting in line or shopping. Participating in strenuous exercise. When you're sick, such as from a cold or an infection. Having your period, menstruation.
In the previous slides from the Cleveland Clinic, it shows the overview of POTS, and in that one section alone there are two key things that stick out. They are tachycardia, which is a resting heart rate over 100 beats per minute. Autonomic nervous system, which is a network of nerves throughout your body that control unconscious processes. These are things that happen without you thinking about them, such as breathing and your heart beating. These two descriptions also point to two groups of persons in the medical field that detectives should have spoken to. Specifically, a board-certified neurologist and a board-certified cardiologist. According to detective notes, police consulted neither. Additional investigation into the condition through a simple Google search would have resulted in detectives finding out that tachycardia is related to another heart condition called arrhythmia. According to the Mayo Clinic, tachycardia is the medical term for a heart rate over 100 beats a minute. Many types of irregular heart rhythms, called arrhythmias, can cause tachycardia. According to the Cleveland Clinic, an arrhythmia is a heart rhythm that isn't normal. Your heart may be beating too fast when you're at rest or just not beating in a regular pattern. For example, arrhythmias range from harmless to serious, with symptoms and without. There are many options to treat arrhythmias, but some don't need them. The prognosis varies greatly depending on the type. Now that all of this has been provided, what does that mean? What does this have to do with Mackenzie and the car crash? Since POTS is an autonomic neurological condition, to make Mackenzie's sudden medical emergency claim believable, there needs to be a condition that satisfies the following criteria. A condition that is related to her POTS diagnosis. A condition that would have rendered Mackenzie unconscious. A condition that would have affected her motor, muscular function. A condition that would have dissipated prior to medical examination. A condition that would be able to explain through medical testimony and/or medical documentation. A condition that could have occurred within the time frame provided, specifically the time from the turn to the time of the crash. Is there a condition that satisfies the above criteria? Short answer is yes, there is. So, what is this mysterious medical condition? Answer, it is called a tonic-clonic seizure, also known as a grand mal seizure. What is a tonic-clonic seizure? The Cleveland Clinic describes the seizure as follows.
What is a tonic-clonic, grand mal, seizure? A tonic-clonic seizure is a type of seizure that causes strong muscle movements on both sides of your body, including convulsions. These are typically the best known and easiest to recognize seizures because of these movements. Tonic-clonic seizures were formerly known as grand mal seizures, from the French phrase meaning great illness. The term tonic-clonic refers to the two phases of these seizures, with the initial tonic phase involving widespread tensing up of muscles in your arms and legs, and then the clonic phase involving convulsions. Conditions and circumstances that can lead to tonic-clonic seizures include aneurysms, irregular heart rhythms, arrhythmias, especially when they disrupt blood flow to your brain, brain tumors, including cancer, cerebral hypoxia, lack of oxygen, concussion and traumatic brain injury, degenerative brain diseases like Alzheimer's disease or frontotemporal dementia, drugs and alcohol. This includes prescription medications, recreational drugs, and even caffeine. Drug or alcohol withdrawal. Eclampsia, a condition where high blood pressure can cause seizures in people who are pregnant. Electrolyte problems, especially low sodium, hyponatremia, calcium or magnesium. Fevers, especially high ones. See our article on febrile seizures, including what to do for a loved one or child who has one, in children. Flashing or flickering lights, especially in television shows, movies, video games, and more. Genetic disorders, conditions you have at birth that you inherited from one or both parents. Hormone-related changes, for example, catamenial epilepsy can affect people with a menstrual cycle, making seizures happen more often at certain points in the cycle. Infections, especially encephalitis or meningitis. Infections can happen because of viruses, bacteria, parasites, or fungi. Inflammation from autoimmune conditions, where your immune system attacks your brain. Insomnia and other problems that keep you from sleeping enough. Metabolic problems, especially high blood sugar, hyperglycemia, or low blood sugar, hypoglycemia. Mental health problems, known as psychogenic seizures, like conversion disorder. Problems with your brain structure, especially ones that happen because of a problem with how your brain developed in the uterus. Sepsis, a life-threatening overreaction of your immune system that happens because of an infection spreading throughout your body. Strokes or transient ischemic attacks, tears. Toxins and poisons, such as carbon monoxide poisoning or heavy metal poisoning.
If you notice, the second condition mentioned is arrhythmias, which is a condition related to POTS. It also states that another potential cause for a tonic-clonic seizure is a metabolic imbalance, specifically low sodium, which is a condition that persons with POTS also experience. What happens to a person who suffers a tonic-clonic seizure? The Cleveland Clinic says the following.
How does this condition affect my body? A seizure is a malfunction in how your brain cells, neurons, send and relay electrical signals. A seizure causes affected neurons to fire electrical signals uncontrollably to other nearby neurons, causing the malfunction to spread. Tonic-clonic seizures are generalized seizures, which means this type of seizure affects both sides of your brain. These seizures make you pass out and affect muscles throughout your body, causing convulsions, shaking, and other kinds of uncontrollable muscle movements. What are the symptoms of a tonic-clonic, formerly known as grand mal, seizure? Tonic-clonic seizures are usually what people think of when they think about seizures and epilepsy. The symptoms are usually more severe and easier to spot and happen in the following phases. Tonic, usually 10 seconds, 30 seconds during this phase, you pass out and muscles throughout your body go rigid, especially your arms and legs, making it look like you're arching your back and lifting your belly upward. Your breathing muscles may force the air out of your lungs, causing you to cry out. Injuries are common if you fall or clench your teeth and bite your tongue. What are the symptoms of a tonic-clonic? Usually 30 seconds to 60 seconds, but sometimes longer. This phase involves convulsions, which are full-body spasms or shaking. You might also froth at your mouth. This phase usually winds down, with convulsions getting weaker and slower before stopping. As this phase ends, you might lose control of your bladder and bowels, causing you to urinate, pee, or defecate, poop. Post-seizure recovery. Up to 30 minutes after a seizure, most people wake up and return to how they felt before the seizure. It's common for you to feel confused, have a headache or feel muscle aches. In serious cases, you might take even longer to wake up, especially if you had status epilepticus.
How would this affect a person sitting in the driver's seat of a car react to this medical condition? Let's take each part as described by the Cleveland Clinic in the previous slide. The person goes unconscious. Such as what Mackenzie described in a post-crash text to Christine Russo, where Mackenzie stated she remembered making the turn, but blacked out. The person's arms become stiff and rigid. If the person is grasping the steering wheel, that grasping becomes more stiff and rigid. This would make it difficult for a passenger to properly manipulate the steering wheel due to the unintentional resistance of the unconscious driver. The person's legs become stiff and rigid, which means the person's leg elongates. If a person has their foot on the accelerator pedal and this condition sets in, it's not unreasonable to believe the accelerator pedal would be depressed further to the floor, thus increasing the speed of the vehicle. To simulate this, the next slides contains 3D figure renderings. In the top row of 3D modeling, we see a reasonable approximation of a normal driving position. The figure appears to be in a comfortable seating position. Their hands and arms are in a comfortable position to properly grab and manipulate the steering wheel. The left foot is in a relaxed position with the foot on the floor of the vehicle. The right foot is extended slightly forward, and the right foot is elevated to properly manipulate the accelerator and brake pedals. In the bottom row of 3D modeling, we see what can be described as a reasonable approximation of a person having a seizure while in a motor vehicle. The figure appears to be in an elongated, seated position while partially restrained by the lap belt portion of the seatbelt. Their hands and arms are in a more rigid and elongated position while grasping the steering wheel. The left foot appears to be pushing against the floor of the vehicle. The right leg is more rigid and elongated, and the foot appears to be pressing further onto the accelerator pedal. So, is there enough reason to believe that Mackenzie may have experienced a seizure between the time of the turn and the time of the crash, and if so, how? We must consider the time frames of when the vehicle goes off camera in the video where Mackenzie is making the turn to when the vehicle reappears on the camera that captures the crash. According to documentation, at 5:34 and 30 seconds a.m., the vehicle makes the turn. According to documentation, at 5:35 and 18 seconds a.m. to 5:35 and 22 seconds a.m., the vehicle is in view of the crash camera and crashes into the building. This is a time difference of 48 seconds. According to the documentation from the Cleveland Clinic previously presented, this is enough time for Mackenzie to experience the tonic portion of a tonic-clonic seizure, which can be as short as 10 seconds and as long as 30 to 40 seconds. According to documentation, at 5:35 and 22 seconds a.m. the vehicle crashes and comes to rest. From 5:35 and 23 seconds a.m. to 6:20 a.m. the vehicle is stationary, and we have no idea what is going on at that time. That is a time gap of 44 minutes. Again, according to the Cleveland Clinic, this is more than enough time for Mackenzie to experience the clonic stage of a seizure, which takes about 30 to 90 seconds, and enough time for Mackenzie to go through the post-seizure recovery timeframe of approximately 30 minutes. On the next slide shows a timeline of events. The details above the timeline is confirmed by police. Everything below the timeline is a hypothetical medical emergency. According to medical documentation, it is very possible that this timeline of events is what actually occurred on July 31, 2022. 5:30 a.m., left 938X, Brushwood Lane. Note, the full address is not provided in this presentation due to social media posting guidelines. 5:34 and 30 seconds a.m., video from Progress Drive and Pearl Road. 5:35 and 18 seconds a.m. to 5:35 and 22 seconds a.m., vehicle enters crash video camera and impacts building. 5:35 and 22 seconds a.m. to 6:20 a.m., vehicle at rest. What is occurring inside of the vehicle is unknown. Asterisk note, time corrected to account for the time discrepancy of 4 minutes, 20 seconds. According to detectives, the owner of the crash camera confirmed that the recorder was 4 minutes, 20 seconds faster than the Strongsville camera. 6:15 a.m., 911 call received by Southwest Emergency Dispatch Center. 6:20 a.m., Strongsville Police Department arrive on scene. 6:26 a.m., Mackenzie begins to regain consciousness. Unable to move due to being trapped in wreckage. 7 a.m., Mackenzie placed in medical helicopter, en route to hospital for care.
Hypothetical medical emergency in the timeline. 5:34 and 40 seconds a.m. to 5:35 and 10 seconds a.m., seizure begins, tonic phase. According to the Cleveland Clinic, tonic stage of tonic-clonic seizure lasts between 10 to 30 seconds. It renders the patient unconscious and also affects patient's motor muscular function. 5:35 and 10 seconds a.m. to 5:36 and 10 seconds a.m., seizure continues, moves into clonic phase. According to the Cleveland Clinic, the clonic stage is average of 30 seconds to 60 seconds. 5:36 and 10 seconds a.m. to 6:06 and 10 seconds a.m., post-seizure recovery period. According to the Cleveland Clinic, average time for a patient to recover from a tonic-clonic seizure is up to 30 minutes. Defense has stated that one of the possibilities for the cause of this crash was a sudden and unexpected medical emergency related to Mackenzie's POTS diagnosis. This condition makes Mackenzie susceptible to experiencing seizures. According to the events of the morning and specifically the time of the turn, to the time of the vehicle impact, to when first responders arrived on scene, it is medically possible that Mackenzie did in fact suffer a sudden and unexpected medical emergency, specifically a tonic-clonic seizure. This would make this an unfortunate, but not illegal, fatal automobile accident in accordance with Supreme Court of Ohio case Lehman v. Hanem. Due to the extended length of time of the suspected seizure until medical evaluation of over 40+ minutes, this would explain why there wasn't any apparent seizure activity at the time when first responders were on scene and conducting an initial evaluation.
Based upon the time of the video of the turn to the time when first responders arrived on scene, over 44 minutes had passed. Based upon information from the Cleveland Clinic published as far as being considered a normal tonic-clonic seizure, 44 minutes is more than enough time for Mackenzie to have had a seizure and be in a recovery stage by the time medics arrived. Based upon this information, it is appropriate to view this case regarding the Supreme Court of Ohio cases Lehman v. Hanem and Roman v. Estate of Gobo. Lehman v. Hanem. On January 4, 1956, Lehman was driving west on U.S. Route 30 in Stark County, Ohio, while at the same time, Hanem was driving east. While they were passing each other, Hanem crossed the center line of the highway and crashed into Lehman's car, injuring Lehman. Hanem claimed that his car crossed the center line because he lost consciousness due to an unforeseeable cause. The burden of proof rested on Hanem, the driver, to prove that he crossed the line because he became unconscious, so it was impossible to control the car, and that he did not anticipate the unconsciousness. Hanem had a physician that testified supporting his claim of unforeseeable unconsciousness, verifying the burden of proof on his part. Loss of consciousness was a full defense to this negligence. The Supreme Court of Ohio ruled that if Hanem had been conscious up to the point of the collision, he would have been guilty. However, when the driver of an automobile is suddenly stricken by a period of unconsciousness which he has no reason to anticipate and which renders it impossible for him to control the car he is driving, he is not chargeable with negligence. The sudden emergency doctrine was uniformly put in place in Ohio, so that not even a man that killed 2 others while being unconscious at the wheel could be held liable. Roman v. Estate of Gobo. In 1999, Nino Gobo was driving a car in Cleveland. He suddenly hit another car, sped up, swerved, returned to the road, swerved again, and ran over a road sign. He came back to the road only to be driving left of the center and crashed into at least 2 cars coming from the opposite direction. Both Nino and his wife, Frances, who was in the car, were killed by the collision. 2 others were killed as a result of the crash, with several other people injured. 2 of the injured sued the estate of Nino Gobo. Gobo's estate was able to use the sudden medical emergency as a complete defense, as Gobo had suffered from a heart attack just before the incident. During the trial, it was brought up that Gobo had a history of issues of narrowing arteries, which made it hard for him to walk. A doctor testified saying that a person that would have narrowing arteries around the heart would be likely to also have narrowing arteries in the leg. However, the doctor also testified that Gobo should not have been restricted in his driving even though he suffered from a sudden cardiac death which could not have been foreseen. It was also noted in the trial that Gobo had bypass surgery in 1979 and had visited physicians several times due to chest pain in the 80s and 90s. The injured parties argued that because Gobo knew about his medical condition, he should be held liable. This dismissed by the court as it would set a precedent for all drivers with any serious medical conditions to have restrictions. What constitutes a sudden medical emergency can range from having a seizure to a stroke, to mental delusions, or to a bad reaction from medication. Additional information. The Mayo Clinic echoes the same information as their Cleveland Clinic counterparts, but the Mayo Clinic provides one final conclusion. Complications. Having a seizure at certain times can be dangerous for you or others. You might be at risk of falling. If you fall during a seizure, you can injure your head or break a bone. Drowning. If you have a seizure while swimming or bathing, you're at risk of accidental drowning. Car accidents. A seizure that causes either loss of awareness or control can be dangerous if you're driving a car or operating other equipment. Pregnancy complications. Seizures during pregnancy pose dangers to both mother and baby. And certain anti-seizure medicines increase the risk of birth defects. If you have epilepsy and plan to become pregnant, talk with a healthcare professional. Your medicines may need to be adjusted. A healthcare professional likely will monitor your pregnancy. Emotional health issues. People with seizures are more likely to have depression and anxiety. Emotional health issues may be a result of dealing with the condition itself or as a result of medicine side effects. This concludes Part 3.